Hello, and welcome to the preoperative total knee replacement class. My name is Katerina Lukasic, and I am the inpatient physical therapy supervisor here at Santa Rosa Kaiser. The purpose of this video is to explain what happens during your hospitalization. I know you may be feeling some anxiety towards your upcoming surgery. I really believe that if you know what to expect from your surgery, it'll make the entire process less stressful. You can approach this experience knowing what's going to happen instead of wondering what's going to happen next. The video will be divided into 4 sections. Section 1 by orthopedic surgeon Andy Goldstein will cover the anatomy of the knee and the method by which your knee is replaced during surgery. In the second section, I'll describe your hospital stay. This will cover everything from the equipment attached to you when you wake up from surgery to the criteria we use in determining your discharge home. The third section will review home knee safety tips. I'll review steps you can take to make your home a safer place for you when you do get back. Just in case there have been topics not covered by the video, I'll finish with questions most commonly asked in my classes.
Hi, I'm Dr. Andy Goldstein, part of the orthopedic department here at Kaiser Santa Rosa. And I've been asked to talk a little bit about artificial knees, to explain a little bit about the anatomy of the knee and what an actual artificial knee looks like. The knee consists basically of your thigh bone, your leg bone, and your kneecap. And when you bend and straighten your knee, these 3 bones all move together as a unit. This represents your left leg and your left knee after all the cuts have been made during surgery. On the top of the tibia bone, there'll be this tibia component consisting of a plastic wafer on top of a metal tray. Once implanted, it'll look like that. And on the end of your femur bone, after all the cuts have been made, there'll be this metal component which fits on the end of the femur. I hope this brief explanation of some of the anatomy of the knee, as well as what an actual artificial knee looks like, will help you better understand what will occur at your upcoming surgery.
Thank you, Dr. Goldstein. Now that you have a basic understanding of the anatomy of the knee and the surgical process, we can move on. When you wake up, you're going to notice a lot of paraphernalia attached to you. What I'll do is I'll start with what's attached to your head and travel down your body. In your nose, you'll have a cannula, and all this is a plastic tube and it carries oxygen. By protocol, all the patients have this, and it's used to help maintain oxygen levels in your blood during surgery. I usually take this off the morning after surgery. Moving down a bit, you'll have an IV, which is usually in your arm. This is the means by which you'll receive fluids, and even more importantly for you, your pain medication enters through this site. You are in control of your own pain medication. The PCA, which looks like a pen with a button on top, is what you can press to administer your own pain medication. Now, you could be asking yourself, well, how do I know when to press this? The answer to that question is when your pain level is above a 4 to a 5 on a pain scale. Now, a pain scale is something we use to determine what level your pain is. 0 out of 10 means you have no pain whatsoever. 10 out of 10 means you have horrible, severe pain. You don't want to get above around a 4 or a 5. Okay. One thing I also want to emphasize to you, you can't overdose. You can press this thing every 30 seconds. It still will administer only once to 10, around every 10 to 15 minutes, depending on what's been programmed into the PCA. Okay. I also want to tell you, I don't want you to fall behind in the pain. And what do I mean by that? You're going to have a certain level of pain. You don't want to get above that 4 or 5, because when I come in, or the physical therapist that will be working with you will come in, it's going to be a lot harder for you to work with them. And remember, they've cut through the bone in your knee. That is going to be painful. So again, please don't be afraid to use your PCA. Now, moving down your body, you'll notice a tube exiting from your knee joint. That tube acts as a drain, and it takes out excess blood from the surgical site. It's usually taken out by the doctor the morning after your surgery. You'll have a catheter placed in your bladder, and this way the first day after surgery you're not going to have to get up to use the restroom. But we'll talk about a little more later. Now, I want to talk about something that's going to be around your calves. It's a massager, and what this does, it fills up with air and it promotes blood flow, as well as it further decreases your chances of blood clots. One thing some patients have, some do, some don't, is something called a CPM, otherwise known as a continuous passive motion machine. Now, it's determined whether you need this depending on how much bending you have in your knee. If you don't have significant bending by the second morning after surgery, we'll be placing this on your leg. It looks like this. Your foot will be going in here. This is all nice soft cotton, and your thigh will be coming up through here. This is a control mechanism, and you won't have to worry about this. I'll be setting it up. But I'm going to turn it on so you can see what it does. And now it's going to start coming up. And you can see if your leg was lying on this, this would bend your knee up, and then it's going to come back down. And then it goes going back down. And it would be on you for about 4 hours on, 4 hours off. Again, we'll determine if you need this depending on how you respond after surgery. What I'd like to talk about now is about your hospital stay. Hospital stay is typically 3 days, and physical therapy we'll see you about twice a day. During these 3 days, this is what I want you to expect to happen. On day 1, I'll be teaching you how to get in and out of bed by yourself eventually. I'll be teaching you how to transfer from going from sit to stand using a walker, and again, depending on how you're feeling, we might take a few steps with the walker. Again, if you're not feeling well, you may only end up sitting up at the edge of the bed. If you're feeling great, you might go for a short walk with me. On the second day, I'm going to review what we did on the first day. So again, reviewing how to get in and out of bed, reviewing how to get from sit to stand, and reviewing how to walk with the walker. On the third day, this is your test day more or less. What we do is I make sure, and you make sure, that you're safe getting out of bed, that you're safe walking, and that you're safe transferring, whether that be, again, the bed, or a chair, or a commode. The goal of physical therapy is to prepare you for home. Remember, there is nothing at home which you will have not first practiced with me and mastered here at the hospital. In order to determine whether you're safe to go home, we've created a checklist which are comprised of 3 goals. 1, and these will sound familiar to you, that you can get out of bed on your own or with minimal assistance from a caregiver if someone's to help you at home. 2, independently transferring from a sitting to a standing position, and this is without losing your balance, from a bed, from a chair, and from a commode using a walker. The third goal is that you can walk 25 feet using a walker without losing your balance. If you are to have a caregiver and they are going to be helping you at home, they have to be present on the final day of physical therapy to be trained in assisting you to move properly and safely so you can manage at home. Most of our patients do go home. However, if you're unsafe to do so, you might go to a rehab center to achieve the goals I had mentioned before. One thing I'd like to ensure you is that we're working together as a team. I will not send you home unless you're safe to do so. Now, in terms of equipment that will be sent home with you, there are usually 2 pieces of equipment that go home with you. One is a walker, and it's identical to the walker we'll be using in the hospital. The second thing that'll be going home with you is something called a 3-in-1 commode. Now, this can be used as a bedside commode. It has handles and a pot at the bottom, Or the pot can be slid out and it can be put over a regular toilet seat, and it's really nice because you can push off to get up to standing. It can also be used in the shower as a shower chair, hence the name of 3-in-1. Since I was mentioning showers, I'd like to remind you may not take a shower or introduce water to the incision until your staples are taken out. This is taken out usually about 10 to 14 days after your surgery and is done during your first post-operative doctor's visit. Now, can you guess why we allow only for you to have a sponge bath after surgery? If you guessed to prevent the risk of infection, you're right. You don't want to rinse bacteria into your wound bed. That would be bad. Any additional equipment needed will be determined by you and the physical therapist working together. Some individuals prefer crutches or a hospital bed for home. We will determine together what is needed to assist you in your home environment. Some other items which may be helpful if purchased are 1. A reacher. This is pretty nice because what you can do is grab things by squeezing in through here, and you get papers off the ground and things like that. Another thing that's nice is an elongated shoe horn, because you're not going to have an easy time bending over, and this way you can slide this into your shoe and you can get your shoe in a little more easily. Now, here in the area in Santa Rosa, Medical Dynamics carry this. It's called a total knee replacement kit. The phone number for Medical Dynamics is 707-573-0302. Redwood Medical Supplies also carries these. Their phone number is 707-585-6800. Finally, there's Pacific Medical Supplies. They're over, I think, in Petaluma. Their phone number is 707-769-9606. Now, all 3 companies deliver and they accept credit card orders. Remember, the things I had just shown, they're not necessary, but they may make recovery time at home easier. Now, we're talked about home. Let's talk about rearranging your house to allow you to move about a little more safely. I will talk about each particular part of the house. I'll divide it up into rooms and talk about each room separately. Living room. A lot of people like to get into deep couches. Now think about it. You're not able to bend your knee a lot. You're not able to extend your knee a lot. If you're going to get into a deep or a low couch, you're going to have a real hard time getting out of it. The thing I tell my patients is think of a turtle on its back. You're not going to have a good leg to push off of there, okay? A better idea is to get a chair with armrests, and that way with the armrest you can push off to get up and get along a little more easily. An idea for the chair to make it even higher is to put a pillow in the chair, and again that'll make it even easier to transfer up into standing. A lot of people have throw rugs around in their living room. Take out the throw rugs. You have a walker you're dealing with, you don't want to have to also be picking that thing up to try to get around a throw rug. Little thoughtless things that people may leave behind, like electrical cords, make sure that they're all removed. So before you have surgery, go through your house, make it safe for your knee. A couple other little ideas. Make sure you have a cordless phone next to you. That way you don't have to get up to use your phone. You could also think about installing night lights to help you avoid falls during night. We'll move on to your kitchen next. The one thing I tell my patients about is the hip to shoulder rule. What is that? Well, you're not going to have a lot of bending in your knee, so you're not going to be able to bend down. And you're not going to be able to get up onto your tiptoes because you don't have the balance. So you want everything between your hip and your shoulder. Go into the kitchen, your cereal boxes, things that people tend to keep up high, put it down to lower shelves. Pots and pans, things that are down low, again, you're not going to be able to bend down. Put it on top of the sink or somewhere else that is a little easier for you to get to. The same rule applies moving on to your bathroom. Keep your toilet paper out, your hair dryer, anything you're going to be using, have it again somewhere between the hip and shoulder height so you can get to it fairly easily. In your bedroom, It's a little easier because, for example, your clothes are up in the closet, so that's going to be nice and high. But what people forget are things like socks, shirts. Make sure you go from the bottom drawer, where some people keep it, all the way up to the top drawer so you can get to it more easily. In terms of shoes, I'd like to encourage you to try to get slip-on shoes. Shoes that have ties are going to be very challenging because you cannot bend your knee enough to get the shoe on. Okay? And finally, loose clothing. Have a pair of loose pants. Tight jeans are not going to cut it with the staples in your leg. Okay? Nice loose fitting slacks, things like that are going to be a lot easier. Now, if you have a spouse or a significant other who can help, they can help you with everything. But for those people who live alone, please arrange to have someone pick you up and drive you home from the hospital. I've had poor people who've forgotten to do that. They've done everything else. They got their house set up, but they forgot to get a driver to drive them home. Okay? Now, when you're home, and if you are by yourself, you are going to need help for a few days with cooking, cleaning, shopping. What you can do, we have a service here. They're called discharge planning. The discharge planners can provide you with information on prices and coverage if you wish to hire help. Their phone number is 707-571-3151. I'd like to close this video with a question and answer session, and I'm using questions commonly asked in my total knee replacement classes. The first and the most common question I get asked is, how long before I can drive? What I tell my patients is approximately 6 weeks. You don't want to be using a walker. You don't want to be using a cane for assistance for walking. If you're still using those, I can tell you you're not safe to drive. I encourage my patients to do a little test run, an empty parking lot before you go back to the road. A lot of people are surprised to find the reaction time to hit the brakes and the gas is a lot slower in their surgical leg. Going along the same lines with driving, people ask about temporary handicap decals. How do I get a temporary handicap decal? Talk to your doctor prior to surgery. And what you can do so you're prepared, pick up forms at your local DMV and then bring them into the doctor. In terms of surgery itself, people ask, how long is my surgery? And it's somewhere around 2 to 3 hours. And then the question, how long will a new knee last? Somewhere around 15 years is the answer to that question. Along the timeline again, people ask, how long will I be walking with a walker or crutches after my surgery? And it's somewhere around 4 to 5 weeks. Now, what I'd like to remind you is the stronger a person is before surgery, the faster they'll be able to walk without the walker or without the crutches. By the other extreme, if you come into the surgery already in a wheelchair, being wheelchair bound, realize it'll be longer than the 4 to 5 weeks potentially. People also want to know, how long will I be in the hospital? As we talked about before, it's somewhere around 3 days. If you're doing great, it may be as little as 2 or maybe a little as high as 4, but somewhere around 3 days. One thing I really want to emphasize to you is dental surgery. People ask, what should I have to do if I have to have dental surgery done? What I tell them, it's best to have dental work done before your surgery. If you're to have dental work done after surgery and you can't wait until that, remember to tell your dentist they have a knee replacement. This way the dentist knows to prescribe antibiotics for you. The reason for the antibiotics is that cuts in your mouth, they can result in bacteria entering your bloodstream, and that potentially can lead to an infection of your prosthetic knee. Remember to check with your dentist or your physician before your dental work. Something a little more delicate, I get a question asked along these lines is, how soon can I have sex after surgery? And my answer is, as it is comfortable for you. Obviously, if it's painful, you might want to be careful. Other activities people ask me about is, what activities can I do? What may I do for exercise? What you want to avoid is high impact things. High impact meaning jogging, tennis. What I encourage you is low to no impact, and that is, for example, walking, Swimming, again, swimming once your wound is completely healed. Biking is perfect. Again, there's no impact with that, and hiking is also okay. Now, this brings to a close the preoperative total knee replacement class. If you have any questions that I did not cover in the video, please feel free to call the inpatient physical therapy department. The phone number is 707-571-4831. I'd like to thank you for your time and your attention.